Hello, everybody. Welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, your thyroid pharmacist. And today I'm really excited to have a conversation about the Healing Depression Project. This is a new model for treating depression. And I'm really honored to be joined by Dr. Achina Stein and Silvia Covelli today. Dr. Stein is the head doctor at the Healing Depression Project. She's a leading expert in functional medicine psychiatry and best-selling author with 30 years of experience helping people recover from depression. She's a board-certified psychiatrist, a distinguished fellow of the American Psychiatric Association, a certified practitioner of the Institute of Functional Medicine, and a former clinical assistant professor of psychiatry and human behavior at the Warren Alpert Medical School of Brown University. She has a best selling book, What If It's Not Depression? Your Guide to Finding Answers and Solutions, offers groundbreaking functional medicine perspectives, instilling hope and providing healing pathways for those facing chronic depression. In the 45-day depression recovery program offered by the Healing Depression Project, Dr. Stein works on identifying and addressing all the root causes of your depression like symptoms. This program is bringing hope to those who have long struggled with depression and have not found relief with other treatments, including antidepressant medications. Sylvia is the founder of the Healing Depression Project. She is an honors graduate from Boston College and a former social science researcher at Harvard University. She pursued graduate studies in finance and business law and dedicated her career to entrepreneurship, becoming an accomplished businesswoman. In parallel with her thriving career, Sylvia faced relentless and chronic depression, exploring over 60 different treatments without finding sustained relief. Her personal struggle, combined with her extensive background in human transformation and mind body connection, led her to develop a program that remarkably eradicated 25 years of depression symptoms, leaving her depression free ever since. And this breakthrough later inspired the creation of the Healing Depression Project. So, thank you both for being here and for the work that you're doing to help people overcome depression. This is such important work.
Oh, thank you so much for having us.
Thank you.
I'm a little bit under the weather today, so I might be coughing here and there, but I really, really wanted to have you both on because depression is such a devastating condition for so many people. It takes so much from them, and yet we almost like normalize it. It's like it's considered to be like a chronic condition. Can we speak a little bit to like the conventional psychiatry approach to depression?
Generally, the approach to depression, a lot of people who have depression typically are seen first by their primary care provider. Many patients are seen by their primary care provider before they even come to the attention of a psychiatrist because there's not very many psychiatrists, available. So there are other providers that tend to see them first. When they do see a psychiatrist, there's an evaluation completed, which is typically looking for a chief complaint, looking for symptoms that meet criteria for a particular diagnosis, where you're going down a decision tree, usually provided through the DSM, which is the diagnostic statistical manual, considered like the Bible of psychiatry, essentially, and coming up with a diagnosis. And generally, it's matching a pill to whatever diagnosis that is provided. And so it's not solely that, but it generally turns out to be that way. A more complete evaluation does include some blood work, and it does include even a TSH if it's done. In my day when I first started psychiatry, which is 30 years ago, it was standard or mandatory to do some blood work to rule out any acute causes or some medical cause to explain the depression, especially if it's an acute depression, and that would include B12, folate, TSH, CBC, comprehensive metabolic panel, maybe a drug screen, a urine drug screen. If they're an elderly person, perhaps a urinalysis. Sometimes people have acute changes based on what's going on in the body. But it's typically thought that if you have acute depression, it might be something biological, which in, when you do that blood work right away, it's ruled out. And then nothing else is ever done again. So for chronic depression, it's then deemed that it is something that is considered part of your genetics or your upbringing, especially if you've had trauma, and that you kind of have to take medications to cause any kind of remission. And if the medication doesn't work, then there's a second or a third or a fourth and even five. I've even had patients who've been put on 7 medications to try to manage the symptoms. Now, don't get me wrong, medications are, you know, life saving if they're used appropriately. They are life saving, and but for chronic depression or mild to moderate depression, I there are so many other things that can be done that are maybe brought up by in passing. Get your sleep in order, eat right, get reduce your stress, but it's not necessarily prescribed in a way that a patient is understands how important it truly is to affect the change in the brain and in the mind. For example, meditation, breathing, getting to bed and practicing really good sleep hygiene, and moving your body. I mean, so there's so much research that shows that you can affect your mood by putting these habits into place. And these kinds of things are known, I believe, by most psychiatrists, but they don't know how to prescribe it. And they kind of bring it up in passing and almost like, that's not part of my job and I don't know how to do it. They don't know how to talk about it, but they know that it's important. So, and maybe they even consider like that's something that their therapist will talk about or some other person on their team, so to speak, will talk about with them and address. And that's nobody's fault. I think the system is is created in such a way that it doesn't provide enough time for a psychiatrist to actually sit down and get the whole picture, so to speak, right? So my evaluations are 2 to 2.5 hours, and I gather a ton of information through a really long intake, looking at all of these areas. So the standard one doesn't really include all of these things. It's very much medication oriented, and if they need therapy, they will refer out to therapy as well. And that's about it. And there's all different kinds of therapy, but it's usually a combination of medications and therapy.
Yeah, as a pharmacist, I used to work with a lot of people just dispensing antidepressants. For a while, it felt like everybody and their dog was on some kind of an antidepressant. And I'm a proponent of using the right medications at the right time. But if it's a nutrient deficiency that's causing the symptoms, I know for example, low ferritin levels. A lot of women with hypothyroidism might have low ferritin and low iron levels, and that can cause similar symptoms. And we also know that an underactive thyroid in itself can cause depression. And I feel like the crazy thing is, and then I transitioned into a more of a consulting role, working with some clients with very complex health needs, is talk to their psychiatrists and their doctors, and none of them are even really looking at like the thyroid function or the B12 or the vitamin D levels. But there are so many root causes of why a person's mood might be off.
I agree. Over the years, doing any kind of blood work has kind of fallen off the table as part of, to me, is standard care. It really should be standard care. And it was standard care, but I agree with you that I find that there are many patients that I see that that standard care, if they are seeing a psychiatrist, is not done. And I think it's just thought, well, the PCP will do that standard care, or the PCP has already done it, and because they hadn't found any root causes, now they're referring to me. But I I think proper care is obtaining all those results, just to make sure that a proper blood work was obtained, even from a conventional standpoint. At least do your due diligence and get the minimum necessary, and because B12 and folate, deficiency are, as well as iron, are well-known root causes for depression. Well known. So yeah, it's a problem, and it's a system. I think a systems problem.
I feel like patients, they're struggling. They're going through so many symptoms. They're very confused and they go to their practitioners and doctors for answers and they get sort of passed around like hot potatoes, right? And so it's like, oh, they didn't do this, they didn't do that. And I would love, I really appreciate you both being here to help educate people because I feel like it starts with self educating to know what you don't know and what kind of care you should be seeking if you are somebody that's struggling with depression, even if you're on thyroid hormones or already, I know a lot of times women will go to their endocrinologist and they'll be on thyroid hormones and they'll say, I still have X, Y, and Z symptom, and they'll get a referral to their psychiatrist. But that psychiatrist just might do very, very limited things in this day and age. Can you speak to some of the comprehensive root causes that you look for when somebody is presenting with depression and perhaps maybe going into some of the we talked about some of the nutrient deficiencies, if there are lab tests or toxins or triggers. I feel like trauma is one that we know about, but there's so much beyond that, right?
Oh, absolutely. I mean, there's biological causes, psychological causes, social causes, working in or living in a toxic environment. Even if you didn't have trauma, that can be very cause significant depression, as well as the physiological. And, what the theory had been for decades was this chemical imbalance. And, that was thought to be the root cause for having mental health issues. And although there is a derangement of neurotransmitters, that's not the cause. That's a downstream effect of other things, and it's primarily inflammation that's the problem. And what I do is I look for root causes of inflammation. As well. And so, besides the nutritional deficiencies like B12, vitamin D, iron, as you mentioned, we want to make sure that we have the appropriate nutrients in order for our immune system to work in our body. And 80% of our immune system is in the gut. And that the gut requires all sorts of nutrients, right? And then there's nutrients that the thyroid needs as well. So selenium, zinc, iron. There's some B vitamins, and just to make the conversion of T4 to T3. And 33% of that conversion of T4 to T3 occurs in the gut. So, I go after the gut, heal the gut to heal the brain, and, primarily looking at food. Food can cause inflammation, and food can be medicine as well. So it's foods, um, infections, chronic infections in the gut that can really burden the immune system. And infections, foods, infections, toxins, mold toxicity is, I cannot tell you how many people have been severely depressed just by living in a moldy home. I actually saw a patient yesterday who's had severe depression, weeping daily, and her results were sky high in terms of mold toxin metabolites. And it was like shocking to her. And she'd been living in this home for literally all her life because she grew up there, inherited the home, lives there alone. And you can imagine with a depressed person, they really don't maintain their home, right? So it's kind of gone downhill in terms of maintenance, and it just becomes a toxic soup with mold. So that was like a big light going on in her body and her mind as to, oh my gosh, you mean this could be it? Yeah, it's like, I mean, the levels were off the charts. I couldn't believe it. It's probably the highest levels I'd seen in a long, long time. So foods, infections, toxins, stress is a big one. And finally, all of these things, particularly your stress hormones, can cause your sex hormones to crash, and that can also affect your mood. So, particularly around times of when you're pregnant or actually, postpartum and perimenopause, menopause. So sometimes people have new symptoms of depression because they're so inflamed that their hormones are completely off, and then they get depressed and anxious, and even have early symptoms of dementia. So they get lots of symptoms but don't realize that it's because of their hormones. So what we generally try to do is bring the body back into balance by addressing these 5 areas.
Thank you so much for sharing that. I feel like hardly anybody really talks about hormones as far as a driving force in depression, but it really deserves a lot more attention. In the postpartum period, I know I had seen studies that talk about using progesterone for postpartum depression or thyroid hormones for postpartum depression, psychosis, and then a lot of women entering perimenopause. I feel like I've seen this too many times where that hormonal shift can actually bring about new onset depression, insomnia, anxiety, and so on and so forth. But yet, I feel like, outside of functional medicine psychiatry, nobody is really focusing on that.
Absolutely. I actually had a patient who had a history, and it was just getting the history that I knew exactly what she needed. She had a history where she had lost 2 pregnancies because she was not able to make enough progesterone to keep the pregnancy viable. So progesterone is progestation. Your progesterone is supposed to go very, very high during the pregnancy. And then when you deliver the baby, then the progesterone comes down. Well, she couldn't bring her progesterone up, and that's why she would have these miscarriages. And so they gave her high doses of progesterone while she was pregnant. Then she delivered, and they did not continue her replacement of progesterone at normal levels, and she became floridly psychotic. And she ended up being on the psych unit multiple times. And then she had another pregnancy. So she was put on psych meds. And then she came out of the hospital. She had another pregnancy. They knew what to do, right? And gave her high doses of progesterone so that she could have keep the pregnancy and delivered. And again, crashed and burned because they didn't give her progesterone. And so finally, her husband found me, and it's like it's very obvious what you need is progesterone here. It was so obvious, and her psychosis remitted just by giving her progesterone. Normal levels of progesterone. It's just she just wasn't making any at all, and so it was amazing to see that. I mean, I've never had a case like that again. But hormones, I mean, you have to look at the history. There's so many clues about, from just getting a really good history. I think the more details you can get in a history and you can put the pieces together, I'm a detective. I figure out where things went wrong, how they went wrong, and kind of piece together what needs to be done. But she was a simple case. I mean, but nobody ever looked at that. No one did.
And it's just heartbreaking because you hear of so many women on the news doing terrible things because they're in postpartum depression or psychosis to themselves, to their children. And it's like, sometimes it's complicated, but sometimes it can be just one little thing that could really move the needle.
Right.
We talked a little bit about mold toxicity. Unfortunately, I've seen people who were just completely changed by mold exposure, children, adults, people who were like the happiest people in the world, and all of a sudden they're extremely, extremely um, depressed, right? It like almost is like coming out of nowhere. What are some red flags for you that it might be mold, and are there tests that you like to utilize in your practice?
Absolutely. I mean, we see it so often, and it's not just depression, also anxiety, brain fog, cognitive impairment, dementia. Absolutely can be caused by mold, and it's one of the reasons why I included it as part of the testing for the Healing Depression Project. That's how common we see it. So, it's really important to test because if you don't address it right up front by starting treatment with binders, nothing else that you do will make that person better. It's really, really important to start them on binders. So, and it's important to get the testing because not only do you want not only do you want to see what mold it is because it depends on the type of mold mycotoxin, but that also helps us to know where to look in terms of like where this could be. So then it really forces the questions like, we've got to have your house evaluated. Like, what are your activities that you're doing? And so I've had a range of patients who were horseback riding, avid horseback riders, and the barn, the hay is full of mold. And what's interesting is I have a patient who knew that the hay was moldy, that she would get fresh hay for her own horse. but didn't put together that that this could also be affecting her. So several people with that were horseback riding. I had one person who was working in a greenhouse growing cannabis, uh, several gardeners in the garden all the time, but mostly in homes where they may not have air conditioning, and there might be hot humid days. Aspergillus is very, very common mold toxin that people just don't think about. Some people think just black mold is mold, the only mold to be worried about. I'm sure black mold, Stachybotrys, and I know there's that is bad. Yes. Oh, I had another patient who worked in a vineyard and was their office area was full of mold. So these are the kinds of jobs that people have had that expose them to mold, but certainly leaky buildings. Old Ivy League buildings that and dorms, many patients who live in moldy dorms. So if these places are not maintained, then they're going to you know eventually be affected. And not everybody's affected. So only 25% of the population is affected, and they are they're like the canary of the coal mine. They have certain genetic SNPs that make them more susceptible. And that's why you can have one person sick in the family. Not everybody, gets sick in the family if it's in the family home. But, people don't think about mold in their water bottle. If you don't wash your water bottle and the ring on the inside, the straw on the inside, if there's a straw, or there is front load washing machines, dishwasher. There's the bottom pan is sometimes full of water and it doesn't drain. Anything that dispenses water, even your refrigerator that dispenses water, there's could be water leaking behind it. Air conditioning units that are put into the window, um, always leaks around, around toilets or sinks. And you have to really have a high index of suspicion and you have to search for it. And people are always surprised. And so sometimes people will say, I like, oh, I definitely don't have any mold in my home. We put them on binders and we repeat the testing. It's like, these numbers are not going down. There is mold. You have to go look. You have to go look for it and be better at looking. And obviously you need to have someone come in and test the environment. You need to test the environment and make sure. And then you need to have a different person that doesn't test to do the remediation. And then you should retest. Absolutely. So yeah, I don't have the numbers in my head, but I'm gonna guess that like half the people in our of our participants did have mold mycotoxins that are being addressed with binders. And it's really important to start them, retest, and watch those numbers come down.
Wow, that's half of the people. That's crazy. I know, I was shocked because we had a front loading washer and dryer, or washer, I should say, and that was full of mold, and then I ended up buying, like, 2 homes after that point, and, like, every single home that I've moved into, I was, like, telling my husband, I'm like, "We need to get a new washer," and he's like, "Are you serious?" And he's like, "Isn't there there's, like, bad mold, but this is this really the bad mold?" And I'm like, "There's no such thing as good mold, like, we just need to get this out of our homes." And I've even heard of, like, water beds, how those were, like, infected in, like, these, and, I had somebody very close to me that died by suicide when I was, in college, and I remember he had this water bed, and even, like, there are so many places where it can hide, like, it doesn't have to be, like, so obvious that it's, like, visible on your wall.
Absolutely. And there's also breast implants. People don't realize that breast implants get very moldy, and if you got sick after getting breast implants, you have to get rid of them. Yeah, you have to get rid of them. So it can make you very, very sick.
Yeah, yeah, that's such a good point, and such a good point about, like, not everybody in the home being affected, because sometimes it can feel like I know, I've worked with clients where they feel like they're the crazy ones because their husband doesn't, like maybe he's got, like, a little bit of allergies, but they're, like, having full-blown symptoms, and then the children might be affected in some ways. Kids might have, like, eczema or PANS or PANDAS.
Yeah.
One thing that you have found incredibly helpful for people with depression is the ketogenic diet. And now I know people with thyroid issues, it's like a controversy about the ketogenic diet. And of course, I'm a big proponent of it when it's done correctly. I personally use the ketogenic diet to help myself get into remission from Hashimoto's. I used it through that weird perimenopause time to help get myself a little bit more balanced. And there are ways to modify the ketogenic diet to be more therapeutic and more thyroid friendly and more mental health friendly. Could you speak to that, how you utilize that diet and then what kind of benefits you're seeing?
Sure, sure. So the ketogenic diet that I like to call it a therapeutic ketogenic diet, because I know that sometimes when people say keto, they think Atkins, and that is not the case. It is 70% fat, 20% protein, and 10% how's that 10% carbs, 5 to 10% carbs. And we use a ketone meter and a glucose meter combination to follow ketones. And we want to bring it into a therapeutic range. So it's really important to track and not just the numbers, but also how you feel. So everybody has a different sweet spot. And but our diet was also gluten and dairy free. So because it's really, to me, it's an anti-inflammatory diet, which is heavier on the healthy fats and healthy proteins. And we found that our participants, and I really have to attribute it to mostly the ketogenic diet, because in the first month we did not address any of the other root causes, with the exception of looking at making sure that people were following good sleep hygiene. They were moving their bodies, and this was all the beginning in the first few weeks, moving their bodies, good sleep hygiene, learning how to breathe, and meditate. And so in 4 weeks of being on the ketogenic diet and really just addressing, like I said, digestion, when we were talking offline, digestion and opening up detox pathways and drainage pathways, we don't usually see a change in mood right away. And in my practice, I don't put every single person on a ketogenic diet, because everyone's different. But we chose this particular diet because of the evidence behind it. And we found that 50% had complete remission in 4 weeks, which is amazing. And 40% had, and this is out of 10 participants. So 40% had mild to moderate. Their symptoms improved to mild to moderate depression. But 50% complete remission is amazing. And I'm sure Sylvia could tell you more about what that really means in terms of the research that's already there.
Well, that yeah, no, those numbers are incredible because I mean, even like through my own experience, like, 25 years with depression, that really becomes like what is called like treatment resistant. That by that, the only thing that that means is that the person has not responded to 2 full rounds of antidepressants, but then like with time it becomes chronic, and then the chances for any treatment to work, they go lower and lower and lower as time passes. And research shows that with chronic or treatment resistant depression, only about 10% of people achieve like remission through a standard like psychiatric treatments. in our group, all the 10 people had like what is considered like treatment resistant depression and chronic, because they had it for an average 25 years, some for 40 or 50, because basically it started when they were a teenager and they never, had a life without depression. Some of them that got like significantly better at the end were saying like, I didn't even remember myself, before the depression. So is basically a life with depression. And that's what's very, very impressive about these results. That we're talking specifically about treatment resistant depression, and just getting just 50% of the people into what the Hamilton scale calls remission, which, for people that are not familiar, the Hamilton scale, it's one of the scales that we use. We use the Hamilton scale for depression, the one with 17 questions. And one of the reasons why we use it is because antidepressant drugs use it a lot in their trials. So we wanted to do, to compare apples to apples, and just being able to see that 50% of people were able to achieve what is considered remission. Again, that means in the Hamilton scale, from 0 to 7, it means that you're in remission, that basically you don't have depression. And higher than 19 points, it means severe depression. For our population, 80% had severe depression. So it scores that, higher than 19%. And yeah, 50% of them, the scores at the end were 7 or lower, even two cases with 2. So basically better than, than anyone walking down the street at that point. And that's extremely, encouraging for psychiatry, because definitely, as someone that was through, the system for so long trying to find a solution, antidepressants, they might work in cases of severe depression, like, but if in the way I see it is that if they're given as part of a treatment, but that's not how psychiatry, conventional psychiatry, works right now. Is just take this pill. If it doesn't work, then they will add something else or change it or create a cocktail. And especially, they will tell you to take it basically for the rest of your life. There's not a treatment plan of like, you're going to be taking this for 6 months and then this is what's going to happen. That's not how it works. And actually, when you want to get off the meds because, for whatever reason, for the side effects or because you're feeling better, they highly advise you against doing that. In my case, I got off the meds despite the doctors, basically, because I just said, it makes no sense. I still have all the symptoms plus a bunch of side effects, so they're not helping, at least like in my condition. So really seeing this, just to talk about antidepressants in this same scale, in the Hamilton scale, it moves the scale about 9 points, but this is what they don't like put in like big letters, is once they take the placebo effect out of the equation, antidepressants only move the Hamilton scale to 1.8 points. That is nothing. It doesn't create, like, if you are a 19 and you go to 18 or 17, your life still has like no quality whatsoever. So just seeing these drops is very encouraging. And basically, what the Healing Depression Project does is, ketogenic diet, functional medicine, as Dr. Stein was explaining, just looking at all these root causes and doing all these like labs. We ran over more than 110 different biomarkers, like looking for, what else is contributing, what in the body is contributing to the depression symptoms, because a lot of the symptoms of depression are physical symptoms. So if you think about it, it only makes sense that there's a physical root cause as well. When you come to the doctor, one of my symptoms was like extreme fatigue, and I always had to beg for like some labs. And it only makes sense that if you have a physical symptom, then a doctor will look for, let me see what's happening in the body that you're experiencing, like this, in my case, fatigue. So is that functional medicine approach of looking for physical root causes? I don't believe that everything is in your head, as many doctors or psychiatrists wants to make people believe about depression. It is way more than just in your head. Your mindset may not be the best. I agree with that, but that is not the reason for for depression. So together with ketogenic diet, especially developed for mental health, we are lucky to have in our team nutritionist Beth Supekenia. She is a world authority in ketogenic diet, and she developed a special diet for the Healing Depression Project. She was there in person for the initial 10 days for the implementation of the diet and made to make adaptations as needed. And then the other part that is, highly mentioned in psychiatry is lifestyle habits. I visit so many doctors and I was never told about diet or about like a sleep or about like nutrition or exercise. It was just, and whenever it was mentioned, it was kind of like towards the end. Oh, yeah, yeah, make sure you're sleeping, make sure you don't have a stress or, something really not as a treatment. And by what we did, we implemented specific like wake up rituals to stop like mind patterns. And then we did meditation, about like 45 minutes of meditation using the meditations of Dr. Joe Dispenza, very focused on healing. And then we also did like an exercise movement, basically walking outside, allowing like sunlight therapy to enter through your eyes and doing some movement. And as you move, we were practicing gratitude, affirmation, so a lot of like positive psychology in it as well. And just some of the people in a group, they haven't been out or moving their body for years. So this was a gradual change, but something that had like significant like impact in the depression.
Wow. Thank you so much for sharing that. It's like I just got tears in my eyes with 25, 30, 40, 50 years of depression and how much that takes from your life, how much that takes from your relationships, from your ability to show up in the world. And 45 days. Your program is 45 days.
Yeah, the results are actually for 26 days because the residential piece is only 30 days. And between one Hamilton and the other, due to being 10 people, we couldn't do everybody on day one and everybody on the last day. So the actual space is 26 days is what we're talking about.
26 days for half of the people to go into complete remission and then dropping from that severe depression. That I mean, just that just brings tears to my eyes thinking of all the people in my life that I know have lived with depression for so long and have been getting the runaround from this doctor to this doctor. And, as a pharmacist, it's like antidepressants, great, but like you can't expect one pill to do what lifestyle and nutrition and addressing your root causes can do.
I would love to give a shout out to Dr. Georgie Eid. She's a psychiatrist who has written the book Change Your Diet, Change Your Mind. For anybody who wants to know all the research around the ketogenic diet, the therapeutic ketogenic diet that we're talking about, she calls it the quiet diet. It's to quiet the system. And she's on the advisory board for the Healing Depression Project. And it's an excellent book, has all of the research. She is a nerd and really, really has all the research. So it really is very, very dense. And for people who like that, read that book. And it's full of recipes, amazing recipes. So this is something that people could potentially do. I don't recommend that you do it by yourself. You really need to get somebody to work with who understands this kind of diet and knows how to implement it. Dr. Eid actually has courses to teach practitioners on how to do this ketogenic diet for mental health purposes. And there's lots of YouTube videos of her where she explains why the ketogenic diet works.
Thank you so much for sharing that. I'm gonna put that in the show notes. It's definitely gonna be like in my Amazon card. Yeah, I mean, I feel like some people might not be aware that I mean, there are just things that they could utilize to help themselves feel better in such a short amount of time. And it's like, it's worth a try. You're totally worth it. Uh, I am glad that you had your first retreat and there were some things, that were surprising. There were some things that were very encouraging and you had some incredible results. What did you learn from that first cohort?
Well, I mean, we learned a lot of things. That wow, the ketogenic diet really works. I have to say it wasn't something that I had done in my private practice because I see all sorts of people, but it's certainly an anti-inflammatory diet. I see a lot of really, really good results. But the significant improvement in the HAM-D was just shocking. So that was amazing. But we can't say it's truly from that because of all of the habits that people were also doing on a daily basis and really really doing them on a daily basis. So everyone was very motivated. Certainly there's a group effect that when you do things in groups you're more likely to do it even if you're a late adopter or a slower person to start or don't feel so motivated. The others will sort of get you out of that groove and get you moving. One thing that I don't know if we emphasize is besides the 30-day retreat, it was followed up with um, uh, daily sessions online once they all transitioned back home to get support in addressing all of the barriers, for these participants in continuing these habits that they've started. A lot of times when you're in the psych hospital or you're discharged and there's just a follow-up appointment with somebody and this is daily contact and making sure that continue these habits. The things that came up for us that were challenging was that there was some people who had gut dysbiosis just from the testing. It was very clear gut dysbiosis, and that the ketogenic diet, and with Beth and myself conferring quite a bit because she would call something keto flu and I would call it Herxheimer's reaction. We realized they were like, oh, that's the same thing. So that was interesting. But the other thing is that she had indicated that people have trouble with the ketogenic diet because they have a gut dysbiosis. And what we found was that those people who did have a gut dysbiosis, and what I mean by gut dysbiosis for the audience, it's an imbalance in the gut microbiome, is that when you move into the ketogenic diet, um, transitioning into that diet, a lot of them got constipated, quite constipated, and some people had. I shouldn't say a lot. I would say maybe half the participants, and about half the participants had challenges of their gallbladder. The gallbladder would be acting up. So I found that I really needed them to take bile salts and betaine HCl much higher than what would be expected from the average person who's on an anti-inflammatory diet. So some people had severe symptoms of, now I would say not some people, two people had severe symptoms of gallbladder dyskinesia and kind of had to back off a bit. And one person was a vegetarian. It's much harder to do the ketogenic diet as a vegetarian. So finding substitutions for her, I think, was a little tough. And being able to give her enough calories in also trying to do that. So, but everybody can get to the goal of ketosis. It may not be as high as we'd like them to be. And not, I do want to say though, that you don't have to be into ketosis to get benefit because I think just the anti-inflammatory part of the diet is so healing, especially if you're coming from the standard American diet. Just removing gluten and dairy can be huge, right? I think you know that. So, but there's going to be people who respond to other things that are taken out in order to remove inflammation, and then you're fueling the brain. What I the way I like to describe it is that you're changing the brain into a hybrid fuel, user of fuel, right? It's ketones and glucose. And a lot of people who have insulin resistance will have trouble utilizing glucose. So it treats insulin resistance. The ketogenic diet treats insulin resistance. It treats fatty liver disease. It treats obesity. There's so many things that get better besides your brain. And we had one patient who lost, correct me if I'm wrong, Sylvia, 17 pounds. He's kind of a football player kind of guy. And so you would never know that he lost that much weight, but he lost 17 pounds. So some people lost weight, and some people who didn't want to lose weight lost weight. So the weight loss is something that also needs to be managed, especially if you're already on the thinner side. So and but people weren't hungry. They didn't have cravings. When you do the ketogenic diet properly, you're not hungry, and you don't want to snack, and you don't want carbs because you're satiated. so so yeah, those were some of the things that came up during the 4 weeks, which we'll have to sort of manage differently next time, and I'm already prepared for that. But we Beth learned a lot about what I do, and I learned a lot about what she does, and so that cross really came together in us working. She's a pleasure to work with. I had such a great time with her, and the one piece that we didn't even mention yet was the psychodrama that was implemented by Stacy Johnson, and out from Georgia, right? From Georgia. Did she come from Georgia?
Oklahoma.
Okay, I'm completely wrong. Maybe she was going to Georgia. Anyway, but she was amazing. The psychodrama. I'll let Sylvia tell you more about her.
Um, Before I go into that, I would like to answer, like, your question when said, like, what is it that we learn during the with this group. And at this moment, I would like to talk to your audience, like people that are going through depression or that they have someone with depression. And one of the things that became clear is that it does matter what you do in your day-to-day life. So it's more that these like lifestyle habits, your lifestyle choices, and that unfortunately, like healing will not come, as this magic solution in a pill or overnight or laying down for a treatment, but that healing requires work. But what this program shows is that it's completely worth it. There's an effort. Like these people were waking up every day before 7 a.m. They were meditating for 45 minutes. They were walking for 45 minutes. They were doing a lot of changes, with diet, regarding hydration, a lot of things. But then what it really shows is that doing it, it's the way out. And that was my own experience as well. I changed everything, and I really implemented these things every day of my life. They still ask me, that was like about like almost now 6 years ago, and they still ask me like when, for how long, for how long do I need to do this, or when do I stop? I don't have the answer because I haven't. So I just continue and became like, my lifestyle. And that's what I have to say to people, that it's and just everybody that was in the program, 10 people, all of them had tried multiple antidepressants and other psychiatric medications, and it's still, they were, experiencing like severe depression. So give that a try, like changing those things. And even if it's an effort, because it's a big challenge, because when you're experiencing depression, in order to make a change in your life, you need motivation, you need physical energy, you need a lot of things that depression itself like steals from you. But then if you don't do that, then the depression symptoms won't get better, and then there is like this cycle. So my invitation is like, even if it's hard, like we have proven that it is worth it. And just, you can start slow. In the program, we start slow and we get gradually to those 45 minutes. So that's probably like the thing that became very evident to me, as as leading this group into these daily habits. So I wanted to say that. And regarding psychodrama, that was the other component. So it would be functional medicine, ketogenic diet, lifestyle habits, and we did 10 days of psychodrama. So psychodrama is an experiential group kind of therapy where you actually like go through the experience in order to heal, post trauma or past experiences. You actually do, they call it a sculpt, and you are reenacting like a part of your life or something that you really want to address or deal with, and the group helps you with that. Of course, the therapist like guides everything through that process. I myself did that for like 7 days, and it was life transformative. And that's why it's now part of the Healing Depression Project. Is this it's the difference between, for example, talk therapy. I mean, you learn things and maybe you become more aware of, oh, this is why I'm feeling this way, or this is why I'm doing A, B, or C, but it doesn't always help you to move through that and to really experience relief in your life or feel better. Instead, like this kind of therapy is shown to, in smaller amount of times, to give you, the results. And that was the equivalent of like 50 hours of therapy. So if you were on the outside world, that would be, like at least 2 or 3 years of being very committed to therapy to do that. And that was also like something very, very transformative for people, being able to address things that were like holding them back from their healing. Of course, trauma, as everything else, is just a process that they need to continue working on. But it was like, a great start to feel at least, some relief from that past experiences.
I could see I haven't heard of that therapy before, but I could see how it would essentially create new neural wiring in your brain because you'd be able to, like, relive those experiences that were traumatic to you and then sort of come out change the outcome and change how you respond to it. So the events might have still been in your past, but you were able to process it a bit differently. So that's a fascinating type of therapy. I haven't personally heard of that before, and it's incredible how transformative that can be. I know you mentioned bile salts and betaine, basically supporting your stomach acid production and supporting your bile through ox bile to help with fat malabsorption, because I feel like that's one of the biggest challenges. And I know people with hypothyroidism, people that are under a lot of stress, which I imagine people with depression tend to have some stress response dysregulation. Is you're going to have low stomach acid, right? And then if you've got these digestive issues, you're going to have fat malabsorption.
And it's also important to eat foods that support your thyroid. Things like seafood for iodine, having Brazil nuts. 3 Brazil nuts a day will give you a good quantity of selenium, and leafy greens for the zinc and magnesium. All of that is consistent with being on the ketogenic diet. And so it is eating the foods that make it also thyroid friendly. And I don't know if that person who asked the question heard that our ketogenic diet was also gluten and dairy free. So to me, that is very supportive of thyroid.
Yeah, thank you so much for mentioning that because I feel like that's one of the big red flags I see is people say they tried the keto diet and they felt worse. And oftentimes it's like, well, if you're eating a lot of dairy and you're dairy sensitive and that's causing inflammation in your body, that just makes so much sense. But if you can take the dairy out and the gluten, which is a very common inflammatory food in general, but especially in thyroid conditions, in my experience, then it's like you've gotten the benefits without the drawbacks of the diet. And so I love that you have modified it for people and then used supports around it to really support them. Um, as far as I know, people are going to want to connect with you ladies. Can you tell us a little bit more about where to find you, where to connect with you, perhaps about the next time that you're going to be offering this life changing retreat? And then I know you also have a gift for people about some mistakes that they might be making. And I'm going to link to that in the comments.
They can go to healingdepressionproject.com, and in there there is a button that they can click to get a discovery call. That's the first step in order to apply for one of the programs, to ask initial questions, and then based on that question, like the questions, the people will receive an application to for the program. At this point, we're only running it twice a year, and each time with about 10 people. So it's very limited spaces. But it's there's still spots for the next program, which we're hoping to run in September, and then another one in March next year. And yeah, the invitation is to reach out and just see if this program is a good fit for you. And for the audience, we have a free e-guide that that highlights the top 4 mistakes that you may be making regarding the healing your depression. It's based on the learnings from this program, as well like my own story of recovery, and that can be downloaded for free also on the website, or at healingdepressionproject.com/gift. So that's the other link where you can go to download it, and yeah, you can get it for free.
And as for me, people can find me at Functional Mind. I have a private practice in Providence, Rhode Island, and it is www.fxnmind.com. And I'm happy to. I have a team to work with anyone who is interested in working with me or us. We have lots of things to offer.
Thank you so much for sharing that. I love that you offer an in-person option for people because that can be so, so incredibly healing. And then people can also work with you, I imagine, virtually if they're not able to come to Rhode Island. Are you licensed also in multiple states?
I am licensed in Massachusetts, Rhode Island, and Texas.
Oh, fantastic.
I have other people on my team that can see people anywhere from the in the country.
That's so incredible because I feel like not a lot of psychiatrists and even a lot of functional medicine practitioners are not as well versed in depression, and you both have really so much heart and passion and care that you bring into this. I really want to thank both of you for being here and taking time out of your schedule to educate us about overcoming depression. I want to thank you, from the bottom of my heart on behalf of everybody that has had somebody they loved living with depression or lost somebody that they loved to depression, for the work that you're doing. You're changing lives on a daily basis, and really appreciate you both. For everybody listening, I hope this conversation has been healing on your journey. If you found it helpful, or if you know anybody that's dealing with depression, even if it's treatment resistant depression, I hope that you'll share this with them so that they too can heal. Okay.